Good morning, everyone. I'm thrilled to introduce our guest of today's interview, Associate Prof Norazlin, a senior lecturer and a consultant pediatrician at University Kebangsaan Malaysia Medical Faculty. Prof Norazlin's expertise in child development is incredible. She earned her MBBS from the University of London and a PhD in genetic epidemiology from Johns Hopkins University. Her clinical focus includes supporting children with autism, ADHD, developmental delays, and learning disorder, as well as those born with high-risk conditions like very low birth weights and also hearing impairments. She was instrumental in establishing the Child Development Center at UKM Hospital, and now is being a model across Malaysia. Her work is transforming the life of children and family through research, education, and care. So today we will explore her inspiring journeys in pediatrics and gain her insights into the future of child development in Malaysia. So let's give a warm welcome to Associate Prof Dr. Norazlin. Yay!
Thank you very much.
So Prof can say hi to our audience.
Hi. Thanks, that's very kind introduction. Just to iterate that actually I wasn't involved in initially setting up the Child Development Center, but I have worked in the CDC for more than 10 years. And yes, it is the first CDC, although there were people who were predecessors to myself. So yes, I'm very happy and proud to work here, but there were giants that I stepped in the footsteps of.
That's incredible. Alright, so for your information, we are now at the HPKK, Hospital Pakar Kanak-Kanak. Alright, so actually at my hand here, I have received a series of intriguing questions that our audience actually would like to ask Prof. Alright, so can I start now, Prof?
Sure.
Alright, so I will just start off with the first question. Okay, this is a very general question. So Prof, what actually inspire you to actually pursue medicines? And specifically, why do you choose pediatrics as your specialty?
Okay, that's a great question. I think to start off with, even when I was young, my parents maybe conditioned me to think about medicine as a career. But as I grew up, I felt that this was definitely an area that I'm interested in because I was interested in people. I wanted to know how they work or they tick and how to help them because maybe in trying to understand myself and people around me. Pediatrics itself, actually I developed an interest when I was a medical student. So when I was in university, when I did my pediatrics posting, I found it really inspiring. All the pediatricians around me were very admirable people and I aspired to be like them. And to be honest, I really liked the atmosphere in the pediatrics department and the wards and the clinics because it's very cheerful. You know, if you go to pediatric wards, it's very cheerful, and of course we have children crying sometimes, but children are very resilient and they kind of get over their pain or sadness very quickly. You know, they prefer to be, I think a lot of them prefer to be happy and to be playful, and maybe that there's something that I respond to with that. I also feel in the pediatric field that children, you know, they're not responsible for the reason that they're sick, right? You can never blame them for that. So it's easy for me to empathize, and I feel that the way that they react to things is more positive. And the whole atmosphere is just more cheerful and maybe playful. So I really like it. I think there's a lot of positive aspects about pediatrics that I really like. And I mean, I really enjoy being with children, and I enjoy, I think, playing with them and just generally being playful.
So, Pro, is there any special moments that you feel like, oh, the pediatric is actually your things? Or is there any someone who actually inspiring you to do pediatrics?
Yeah. Actually, as I said, during my pediatrics posting itself, there was a pediatrician who I thought showed all the exemplary behaviors of a doctor, you know, compassion, patience, dedication, and I really felt like that's the kind of person that I want to be. And then I enjoyed being in pediatrics itself, and I have had experience in dealing with and being around children with developmental problems, you know, like children with autism, for example, or ADHD, even from a young age, because I have family members with those conditions. So it really opened my eyes to what it is like to have a family member and to have children with neurodevelopmental problems, and how we really need to give support to their families and really help support these children themselves in the best way possible. Because sometimes people misunderstand these children and they can be stigmatized. So I really feel that this is a field that needs more people being involved. Nowadays child development is not child developmental problems like autism or ADHD or learning problems is not something rare. We see it a lot, even speech delay, right? Especially after the pandemic. So there is a lot of need for it in our society. So I feel really humbled that I am able to be involved in this field.
Alright, thank you, Prof. So let's move on with the second question. So could Prof elaborate on the education pathway, like what kind of trainings, what kind of education have you go through to become a pediatrician?
Okay, it's been a long journey. So I guess I started off after my SPM. I was lucky or privileged enough to get into a program where I ended up in the United Kingdom. So I did my A-levels there, and then from then I applied to university, and I got into it used to be called Guy's and St Thomas's. Now it's part of King's College. And I was there for 6 years because I did intercalated BSc. So even from then, I was interested in how the brain works. So I did my BSc in neuroscience. And from then onwards, I really liked to go into the direction of how the brain works, how people's behavior is affected by the brain. And then as I grew older, I enjoyed pediatrics as a medical student. So after I finished medical school, I started applying for jobs in the pediatric field. So in the UK, this was called an SHO posting, or like an MO, program. And I did my exams, which is a membership for the pediatric exams in the UK. And after completing my exams, I actually came back to Malaysia and joined UKM as a lecturer. So as a lecturer, I had a lot to learn. And I did learn a lot in the Department of Paediatrics. So I've been here for more than 20 years now. Yeah. So I started as being like the baby in the department, and now I'm one of the oldest. So and along the way, I found out that I was interested in developmental pediatrics, and I was lucky because UKM is the place where the first CDC was established. So I was very privileged to be around people like Prof Juriza and Prof Raja Juanita, Dr. Ranjini. They were the pioneers, as well as Professor Dato Zulkifli. They were all they're pioneers in this field and started the CDC. So I was very privileged to learn from, very young in my career. And I started being involved in the CDC. I started my training in the CDC. After a few years, I decided that to be an effective lecturer and clinician scientist, I need further training. So I tried applying to places for a PhD. It was very challenging. I didn't get in the first time I applied. The next year, I applied to more places, including Johns Hopkins. And again, I was very lucky to be shortlisted, and I went for an online interview, and then luckily got into a place in Johns Hopkins. After which I applied for a scholarship and went there for my degree, which is a PhD. And the PhD in the States is interesting because the first 2 years is like didactic learning. It's like going back to university. We had to take courses in epidemiology, biostatistics. We had to pass the courses and maintain our GPA above 3.5. And then only will they allow you to perform, to start doing your studies in your PhD, right? So I only started that after my second year. So after completing it, which was probably the hardest academic qualification that I obtained, I came back to UKM, and I think it really taught me a lot about how to be a clinician scientist, how to be a better lecturer, better teacher, and a better researcher. So it was definitely very tough, but it was worthwhile, So it's important to learn that sometimes difficult things are worthwhile doing. So you really struggle through it, but once you get there, you will benefit a lot. So, and since then, I've been working back in the CDC. And now, it's very busy, busy CDC. I'm very lucky that I work with a bunch of really great people, including clinical psychologists, other therapists, and other specialists in this area, and a great bunch of support staff, including nurses. And now I have fellows who are also training in it. Yeah, so that's been my trajectory so far.
So from a learner becoming an educator.
Yes, that's right.
It's indeed a very long and also a tough journey.
It is, but it's worthwhile. It's worthwhile. So, and you realize that being a doctor is not service alone. Service is a big part of it, but the service, your clinical service, that informs you about how to teach your students and informs you about the research that needs to be done. So you try and incorporate all of that. And although it sounds like a lot, it's actually really fun. So your life is not boring because you have a combination of seeing patients, a lot of the clinical service, which is very fulfilling, and also the research, because of course we should learn from our patients and improve the knowledge about science in your area, as well as teach. And without having patients, how would we teach? And without our students, how would things move forward, right? Because you are the doctors in the future, and we want you to be even better than us. So, it's a journey to hopefully achieve greater success in the future.
Right. Wow, it's amazing, right? Okay, so let's move on to the next question. All right, so this is a very interesting question. All right, so may I know, Doctor? Prof, sorry. So, as a pioneer in establishing the Child Development Center, which is CDC at UKM, what was the most rewarding part throughout this journey?
Right, okay. As I mentioned, there were people whose footsteps I walk in, because I wasn't the first one to start it, but I was with them practically from the very early on, because they were my colleagues here in UKM, and as I said, it was established here. So I think what was important then was that there is a big need for children with neurodevelopmental problems to have a place to go to where there are people who specialize in it. Not only are we pediatricians, but we are developmental pediatricians. So we're looking at the more complex issues in neurodevelopment. Now, what's also important is that developmental conditions is actually fundamental in pediatrics. It's a big part of pediatrics. And I think more and more pediatricians are starting to realize that, which is why, your developmental, when we teach you about development, you have to understand about normal development, and you learn that as a medical student. And as you get older, we teach you about the complications when development does not go the way it should, when a child has neurodevelopmental issues. So this is actually really important, because it's very important as a pediatrician to understand about normal development and about when it goes wrong. So I think that UKM has played a fundamental part in that, and I'm very lucky to have been to become part of the journey.
Thank you, Prof. Alright, so So now we have come to the second part of the interview, which is challenges and also growth. So I actually have one question here. It's because for now, Prof actually have a lot of role as a doctor, as educator, and so you have your own family. So how are you actually manage your time properly? How are you actually divide your time for all this role?
Yeah, that's a really important and interesting question, right? Because a lot of people can do a lot of things, but when you have so many things to do and you have to juggle them, it gets difficult. Because of course, we need to prioritize, and it's hard. You want to be the best doctor, you want to be the best spouse, you want to be the best mother, you want to be the best daughter, you want to be the best friend, and it's not always possible to do everything all at the same time. So I think it's really important to understand about how to manage your time, and that includes knowing how to prioritize, right? And I can't say that I'm an expert. I think I'm still learning, right? I think it's important to be open to learning how to manage your time, how to do things better, how to acknowledge sometimes when we make mistakes and learn from it, right? And of course to gain knowledge, because we don't know everything. Maybe there are things that other people can teach me about how to do better, right? So it's not an easy journey, you're absolutely right. And sometimes you have to course correct, meaning, okay, when you make a mistake, you're like, okay, I have to learn from this, how do I do this better? At the same time, you have to take care of yourself. You have to take care of your mental health, you have to take care of your your physical health as well, because you can only be the best of you when you are well yourself, right? So that means taking care of the whole of your health. And of course, being, in terms of relationship with people, trying to do your best, being fair with people, treating people with humanity and with respect. And that's true with people in your family, and that's true with people that you meet outside, your colleagues, your friends, your seniors and your juniors. So we need to treat everybody with respect. So we need to minimize on issues like bullying or putting people down. We need to respect everyone for their humanity and their individuality. Although at the same time, we help try to correct the things which are not right in the best way, in a respectful manner. So I think there's no easy answer, but as long as we keep learning, being open to accepting our mistakes and learning from it, and trying our best to manage our time and prioritizing what's important. Then after that, maybe forgiving ourselves and each other if we're not perfect. And I think that's the best that we can do.
Right, thank you. And personally, I have actually one question, because previously I've encountered one doctor. So she's not actually an ENT doctor, and she said that previously she's also taking pediatrics, but then she said that she cannot actually take the workload. She's saying that because at the pediatrics, it's like every morning, I think it's basically every morning you have to go through meeting of the post-mortem, right? Basically post-mortems, like a lot of baby die, like today is still okay, but then tomorrow suddenly died.
Okay.
Yeah. So what do you think about this?
I'm not sure exactly what the person is referring to, but of course there are times in pediatrics when you have very difficult situations. Death is of course one of it, and that can be very hard. It's hard when you're dealing with adults, let alone children. So I don't think it's ever necessarily easier, but we must have a lot of compassion for the family, respect for the family, the child, and just do our best, and always, respecting what other people's needs are. I think maybe some of the things that she mentioned is to do with having to deal with this emotionally. Yeah. And it's really hard, isn't it? It's never an easy thing, right? Because death is difficult, illness is difficult, and sometimes not even death. Like, for example, in my field, it's basically the challenges in life, living with a child with neurodevelopmental problem can be very stressful for families, and that can also be hard to deal with every day to day. So it's trying to find ways to manage that, manage your emotions, manage other people's emotions. When we're talking about health, right? Your physical health, your mental health, that's all very, very important. So maybe there are times when you need to know when you need a break, you need to know when you might need to talk to someone or need to get help yourself, and for us to accept that sometimes getting help is okay. It's all right to not be okay and to ask for help, right? And these are not easy things. I don't think we should be so used to it that it's not a big deal, because it's always a big deal. So we must always maintain our compassion, but as we do that, we also need to take care of our mental and emotional health, and acknowledge that this is not an easy profession, but we are doing it for a good reason, right? For a very noble and holy reason. So I think keeping that in mind and trying our best every day, being compassionate, being kind to other people and to ourselves really, really helps. For some people, maybe it is too much. So yes, maybe a certain career is not for everyone. So part of the journey is finding out what's right for you, right? So maybe this career pathway might not be right, maybe another career pathway is better, right? But the same the same career pathway might be suitable for someone else, right? So it's really trying to find what's the best fit. And while you are getting there, also understanding yourself, other people, respecting them, and taking care of your health, your mental health, your emotional and physical health as well.
Right. So allow me to ask one more question.
Sure.
Right. So as we know, in children's we will have a lot of these congenital disease, right? So a lot of disease that we rarely see. So is there any most difficult case that Prof have encountered? Anything?
Okay. To be honest, the degrees of difficulty depends on the child and the family, and also partly us as well, how we are feeling ourselves, right? I think for me, when I was doing oncology as part of my training as a pediatrician, I did find it's quite tough emotionally. So I really take my hat off to people who do that field. I think it's not easy managing that. Maybe that wasn't the best fit for me, which is why I do child development. On the other hand, not everybody feels that child development is suitable for them or easy, because you have to deal with families who are in distress and children who often behave the way they do because they have neurodevelopmental issues. For me, I think I'm more used to it or more accepting of it because I've had the experience. I've also had personal experience in it, and I guess for me, I really feel like I at least understand to a certain level maybe how the child feels and how the family feels. Not 100%, right? There are cases where I've had a child with neurodevelopmental problems and then having a life-threatening condition. And that can be really hard. The parents are already under a lot of stress. They know their child is potentially not going to survive a long time. So actually I have a patient like that, and I think I learned a lot from the parents because they took it all with a lot of grace and a lot of patience, and they went on to accept the child and accept whatever was meant to be in the most understanding and graceful way. But it's not easy. It's never easy. And when I come across things like that, I realize that I still have a lot to learn. And people, even our patients and parents and families, have a lot to teach us, and we should be open to that. So because it's not just us telling them what to do, it's them teaching us about life.
Alright, thank you, Prof. So before we wrap up with our interview, is there any short advice that Prof would like to give to our audience, specifically those who would like to pursue pediatrics after this?
Okay, I don't know if I'm the best person to give advice, but I would say that I hope that those of you who have an exposure to pediatrics enjoyed yourself, or could at least see a glimmer of interest and hope in it, because really pediatrics is such a rewarding field. I really feel like I've learned a lot from my patients, and it's very joyful in many ways. People can sometimes be turned off by the crying kids, but they don't cry all that long, and children are wonderful. They're really wonderful, and you can't blame them for anything. You can blame parents sometimes, but not them. So I really think it's a really nice specialty to be involved in. I hope you keep an open mind about it and feel that this is worthwhile and a potential field that you might want to be involved in the future. Thank you.
Alright, so a big thank you to Prof Norazlin for sharing your heart-hurting journey and also insight with us today. So it's truly inspiring to hear Prof commitments in these pediatric fields, alright, also driving the future of pediatric Malaysia. So we wish you all the best in your future endeavors, and also we're excited to actually witness the incredible impact that you undoubtedly we're going to continue to make in the future. Alright, so once again, thank you to Prof Norazlin to share with us your story today, and also thank you for your time.
You're welcome. Thank you.
Thank you. Bye.
Bye.